Proposition 4 was put on the ballot by petition signatures. If passed by voters in this election, it would allow the state to borrow $1.5 billion by selling general obligation bonds. These funds would go toward grants for construction, expansion, renovation, and equipping of qualifying children's hospitals. For some background, state law designates 13 hospitals in California as children's hospitals. These include 8 private nonprofit hospitals, as well as the children's programs at the 5 University of California Academic Medical Center campuses. Children's hospitals focus on treating infants and children with severe illness or injuries, or complex chronic health conditions that require specialized care. Many children receiving services in these hospitals are from low-income families. This measure authorizes the state to sell an additional $1.5 billion in general obligation bonds for capital improvement projects at the 13 children's hospitals and other public or private nonprofit hospitals that treat eligible children. The measure allows for the money raised from bond sales to be used for various purposes. This includes construction, expansion, remodeling, renovation, furnishing, equipping, financing, or refinancing of eligible hospitals in the state. The measure requires that the funds provided not exceed the total cost of a project, and funded projects be completed with a reasonable period of time. We estimate that the cost to taxpayers to repay the bonds would total $2.9 billion to pay off both the principal, $1.5 billion, and interest, $1.4 billion. This would result in average repayment costs of about $80 million annually over the next 35 years. This amount is less than 1/10 of 1% of the state's current general fund budget.